My name is Mimi. I am a pharmacist and working at Hillsburg District Hospital as a pharmacist in charge. Today, I would like to offer you some information about medication and hand sanitizer that I believe will be useful for you during the COVID-19 pandemic. There are three topics that I would like to touch on today. The first one is using ibuprofen, which is also known as Motrin or Advil, versus acetaminophen, known as Tylenol, for fever and pain during this outbreak. We have known so far that using ibuprofen does not increase your risk of getting an infection with coronavirus. Therefore, if you are currently taking your Motrin, your Advil, your ibuprofen for pains, for aches related to arthritis, or muscle aches or headaches, you are okay to do so. So don't stop what you are taking right now for those conditions. As always, taking ibuprofen for a long period of time can damage your stomach, known as stomach ulcers, can cause internal bleedings, and also some kidney damage. If you have one of these medical conditions at baseline, it is wise not to start on ibuprofen unless you talk to your primary care physician or pharmacist. Now, if you have no risk taking ibuprofen for your fever or pain, just remember, when you are taking ibuprofen as an over-the-counter product, do not exceed 1200 milligram over 24 hours period. And also report any sign or symptom of bleeding, such as bruises or gum bleed or nosebleed, to your primary care physician right away if that happens. Compared to ibuprofen, acetaminophen, also known as Tylenol or paracetamol, the acetaminophen has less side effect compared to ibuprofen regarding stomach upset or stomach ulcer. However, acetaminophen can cause some liver damage and can lead to liver failure if you take acetaminophen in doses higher than recommended. When you take ibuprofen or acetaminophen for pain or fever, if your fever gets worse or lasts more than 3 days, you need to call your doctor and stop taking the medication until you can communicate with your providers. And if you take the ibuprofen or acetaminophen for pain, if it lasts more than 10 days or get worse within more 10 days, you will also need to stop and call your pharmacist or your primary care physician. The second topic I would like to talk about today is hand sanitizers. Right now, the U.S. Food and Drug Administration published online a notice on not buying any hand sanitizer produced by Mexico-based manufacturers. All of these products produced by S Biochem, these products contain methanol as active ingredient. Methanol can be toxic if it is absorbed through your skin or when ingested. Therefore, if you have any hand sanitizer that contain methanol as active ingredient, then you should not use it. Recently also, there are many other products, hand sanitizer product containing ethyl alcohol. So as a consumer, you would want to know, should you buy this product or if you should not buy this product. As a whole healthcare professional, I would recommend against buying it. Ethanol containing hand sanitizer is a product that could be contaminated with methanol. And as I mentioned, methanol is a toxic agent and therefore it is not a good hand sanitizer for your health. As a healthcare professional, what I would recommend to you for hand sanitizer is a product containing isopropyl alcohol 70%. Isopropyl alcohol is also known as IPA. So when you buy a hand sanitizer with an active ingredient listed as IPA 70%, it is a good hand sanitizer to use. With this hand sanitizer, it may require you to rub and let it dry for about 20 to 30 seconds. Within the 20 or 30 seconds, the bacteria or the virus will be killed. Now, these days, we are going to the supermarket. We are going to Costco and we find out we cannot purchase the Clorox wet wipes. So what do you do at home when you want to disinfect certain things like countertops? What I would recommend for you to do as a pharmacist is that you can compound or mix certain ingredients and make your own sanitizers. So if you look at the information listed here, you can purchase isopropyl alcohol 70%. Then you can also buy hydrogen peroxide 3%, glycerol 99%, and distilled water. With these 4 ingredients, you can make your own sanitizers. The specific volume that I list here is the formula that you should use to create an effective sanitizer of 63% alcohol. When you use 63% hand sanitizer that you created, just remember you have to use it within 30 days of mixing it. The Food Drug Administration allow for us to make hand sanitizer or sanitizer for personal use or for our own use. However, since we don't add in preservative ingredients, the solution is only good for 30 days. So do not use the sanitizer that you make beyond the 30 days period. When you use your own sanitizer, you can spray on the surface fully and then use a paper towel to wipe it off and then let it dry 2 minutes. Within the 2-minute contact with the surface, the bacteria or the virus should be killed. Lastly is the topic that I would like to talk about. It is about prescription medication refill. During the pandemic, many pharmacies and many health insurers allow for patients to have a longer supply of medication. Usually they allow 30 days supply of refills, but now they would allow 90 days refills. So make sure when you talk to your pharmacist, you mention that you would like 90 days refill. During the COVID-19 pandemic, it is recommended that you may need a longer supply of your medication, especially when you have chronic conditions such as hypertension, asthma, hypercholesterol, diabetes. So remember to ask for 90-day supply, so in that way you don't have to come and get your refill every 30 days. Another thing that you want to know is that these days, since we all want to limit our contact, our going outside of our home, there is free medication delivery service available at Walgreens and CVS. When you talk to your pharmacist, you want to mention to them that it's a service that you would prefer. At Walgreens and CVS, what they would like you to do in order to receive the free delivery of medication is to sign up for text alerts or download their pharmacy app. With this app, you can order medication online, and from there, within 5 to 10 business days, your medication will be delivered to you at no charge. You can also have the medication delivered to you sooner if you are willing to pay a fee of $12.95. And with that service, you may get your medication within 1 or 2 business days. Thank you for listening. Please stay safe